Yeah, this segment, I'm just going to kind of on a high level, touch on the cost variables available in the Part D file, like Steph just mentioned. And so, well, first of all, why use the PDE cost variables? Many researchers are often interested in examining medication spending. Asking questions like, for example, how much do beneficiaries spend on medications? What is the monthly cost of a specific drug? What is the average out-of-pocket spending on drugs among enrollees? Those types of questions. So the cost variables in the PDE will allow us to answer these sorts of questions. So the two most commonly used PDE cost fields for measuring drug spending are the total RX cost amount, otherwise called the gross drug cost. And that will identify the total cost of the drug, according to the point of sale transaction. And the second is the patient pay amount. And that's the amount that the beneficiary paid out of their own pocket. The Part D drug event file contains information on the point of sale cost of the drug. So the cost associated with the Part D transaction, the event, when it was filled at the pharmacy. So what it does not include, the PDE file does not include, unfortunately, is information on plan-specific bids, does not include rebates, reinsurance, or payment data that are collected outside of the Part D event. And, that is to protect commercially sensitive plan data that Part D plans don't want shared publicly, excuse me. So for this reason, you can't really determine the true costs to Medicare or plans for prescription drugs. Because without those, other components, you don't know the total, you don't have the total picture. But the variables in the PDE can be very useful for conducting research on cost. So starting with the total RX cost amount, just kind of on a high level, describe it. It contains the total gross cost of the drug. It is calculated as the sum of the variables below: ingredient cost, the dispensing fee, the total amount attributed to sales tax, and starting in 2010, the vaccine administration fee. Those components are not available in the PDE drug event file. FYI. The mean value for the total RX cost amount in 2021 was $143. The median was $13.60. So you can see just how much the high cost drugs are pulling the mean above the median. There's just a big difference between the two numbers. So who is paying for the gross drug cost? This slide gives you kind of a overall picture, breakout the percentages of the payment streams that are covering these drug costs. So this is an aggregated look of the entire 2021 file, broken out into percentages by the different payment streams. You can see there are 7 components. They're listed in the legend on the right. And I'm going to be briefly just sort of like touching on each of these as we go further along in this segment. So this kind of, you can refer back to this to kind of give you a sense that you see that the bulk of payments are made by Part D plans. So that's in the in the orange here. Covered plan paid amount 63%, followed by the low income subsidy is paying for about 14.5% of all PD drug transactions in 2021. Next biggest category is the patient pay amounts. That's what patients pay out of their own pocket. Next is the gap discount. It's about 7%. PLRO amount or 4%-ish, and then non-covered plan paid amounts 3%, and a really small amount paid by other true out-of-pocket funding. And just to let you know, like most drug events aren't going to have all of these components. They're not going to, like most won't have values greater than 0 for all of these components. They'll just have values greater than 0 for a few of them. So here, if I didn't say it already, if you sum up all 7 of those components of PDE record, you should get the gross drug cost or total RX cost amount variable. They should equate. So, here's just an example of, summing each component gets you the total, $143.51. And it's as simple as that. So yes, like I said, I'm going to just briefly touch on each of the 7 components now, starting with the patient pay amount. This is, so this is the amount that the beneficiary paid that was not reimbursed by a third party. This amount does contribute to a beneficiary's true out-of-pocket amount, but only for covered drugs. So covered drugs means Part D covered drugs. The vast majority of drugs in the PDE file are Part D covered, and you can see the distribution listed here for 2021. 99.6% had indicator as covered. There's a drug coverage status code variable in the file that will tell you. Most drugs are Part D covered, but so the ones that are like in the smaller categories, those are like maybe drugs that are paid under an enhanced Part D plan, or perhaps an over-the-counter drug covered by a plan. Some plans will pay for over-the-counter drugs if they're part of an approved formulary step edit. Yes, some plans have like enhanced benefits that are sort of like supported by higher premiums. So for 2021, the mean patient pay amount was $11.90. It's kind of segueing into the next component I'm gonna talk about is the low income subsidy. This kind of shows you what those who do have a low income subsidy, what their mean was. Their mean was $1.31, and those without a low income subsidy is $17.40. So a big difference there. So again, the Part D low income subsidy program, also called LIS or Extra Help, is a federal government benefit provided by the Social Security Administration and CMS. I think they work together to enroll folks in the LIS program, I believe. And the subsidy, reduces the cost sharing that the beneficiary is responsible for, and it's based on their LICS status, and there are like I think I touched on in the MBSF segment earlier this morning, there are, I think 6 or 7 different levels of subsidy. So it kind of depends on where the member falls, depending on their income in the coverage and the benefit they receive. CMS reconciles the prospective LICS payments made to the plans with actual LICS amounts incurred by the plan at the point of sale. So it's kind of a reconciliation that happens after transactions actually occur, but they upfront receive like a kind of a expected payment from CMS that is later reconciled. In the 2021 PDE data, 34% of records had a LICS amount above 0. The mean LICS amount, LICS amounts for those with a value above 0 was about $61. Median $8, and the mode was $3.70. So the next component is the other true out-of-pocket amount. So this amount records all qualified third-party payments that were made on behalf of a beneficiary, but it does not include the LICS subsidy or the patient pay amount. Some examples are qualified state pharmacy assistance programs, charities, and other TROOP eligible parties. So yes, if I did not already say that, this amount would count towards beneficiaries TROOP. Yeah, it seems kind of obvious, but yes. So when it's populated, the mean was about $26. But just a really small percentage of records have a value above 0, only 1.5%. The next component is called the patient liability reduction due to other payer amount, or PLRO amount. So this is the amount the patient liability was reduced due to other benefits not captured by the other variables like the LICS and the other TROOP amount. Examples include like group health plans and workers' compensation. These values are separated because they are not TROOP eligible and they don't participate in Medicare Part D. About 12.5% of all records in the 2021 PDE had non-zero PLRO amounts. And when populated, the mean was about $49. So the next component is paying for the bulk of these PDE events, and that's the Part D covered D plan paid amount. So this is the amount that the Part D plan paid for the transaction. Here you can see the distribution from the 2021 data. The minimum and mode is 0, and those are driven by beneficiaries that are still in their deductible phase. But the mean is $90 and the median $1.36. Again, you can kind of see how those high cost drugs are really pulling that mean away from the median. There is another component variable that goes into the total gross drug cost, and that is the non-covered plan paid amount. This applies to plans with enhanced benefits, and it's rarely used in research, but it is used for plan and CMS accounting. So these plan paid amounts are non-covered plan paid amounts are recouped by the plan through higher premiums for the enhanced benefits. I think I talked about that a few slides ago. There's a indicator variable that will show you which drugs were not covered, officially covered drugs. Very small percentage. So the last component is the reported GAAP discount amount. So it's the amount of the discount provided by the drugs manufacturer under the Medicare Coverage Gap Discount Program, as calculated by CMS based on the data reported in the PDE. It is a new variable to the PDE as of 2012, but note that the gap discount program actually started in 2011. So if you're using the 2011 data, you will not see a gap discount amount variable, but you can calculate it. Yes, so the variable, the gross drug cost, the total drug cost variable, continues to include the full cost of the drug, but so you can calculate the gross drug cost by taking the sum of 6 variables and then subtracting that from the total drug cost to arrive at the gap discount. So here you can kind of see how you would do it. You just take, for 2011 data, you take those 6 components and subtract it from the gross drug cost variable to arrive at the gap discount of $5.53. Yeah. Okay, so for data years 2006 through 2010, there was, no gap discount program. So you won't see that variable in the file. And if you sum those 6 components, it should calculate to the total drug gross drug cost. So just kind of thinking more about how we would use the PDE cost variables to do research. Suppose you're interested in the average annual drug spending per beneficiary. What variables would you use? You could simply use the total drug cost to calculate a value for that research question. How about what if you're interested in looking at the average monthly cost of a particular drug? Which variables? Again, the gross drug cost variable would, you take that and you could divide it by the day's supply and multiply that number by 30 to get an average monthly cost for that drug. What about if you're interested in the average out-of-pocket spending by beneficiary? What variables would you use? You could simply use the patient pay amount. I think some researchers include, other troop variables, but I think it's common just to use simply the patient pay amount for that type of question. So here is a chart of, to give you an idea of what you could potentially produce using the PDE data. Everything in the PDE, or everything you need to create this chart, is in the PDE files. So, this figure depicts out-of-pocket spending for specialty cancer drugs by year among beneficiaries with no LIS. And the file contains the way to, indicate if there was an LIS amount paid, and we can determine what the beneficiary paid out of pocket. You can identify cancer drugs, and yeah, so pretty cool graph. Get you thinking. So this is the last slide. I'll just ask, what variables would you use to get patient out-of-pocket spending? I think I just said a minute ago, certainly researchers would want to use the patient pay amount. Some researchers would also include the ones in blue here, the other true out-of-pocket amount and the PLRO amount, but those two are generally very small amounts and would not really have a big impact on the results, as I understand it. So, that is out-of-pocket amount is really driven by the patient pay amount.